Put your spine back into perfect alignment so that you can eliminate back pain, have more energy and sleep better.
Revealed. Unlock your spine in 10 minutes. Without invasive surgery, addictive band-aid medications and time-consuming appointments. Dear friend, did you know that worldwide, back pain is the single leading cause of disability and accounts for 264 million lost work days per year? Have you been living with debilitating and agonizing back pain for years? Are you feeling frustrated and hopeless because nothing has worked to give you any true, lasting relief and ultimately no solution to the daily pain and suffering you endure? How many hours and dollars have you spent on chiropractic treatments, doctor's visits, massages, and medications only to wake up in the same excruciating pain every day? How many times have you heard, at least once if not more, that surgery is your only option? More specifically, the S-curve of the spine is surprisingly exaggerated and needs to be corrected. Kyphosis and lordosis images are shown. Many people today have some degree of kyphosis. It is also sometimes called a round back or, in worse cases, a hunchback. This is a rounding of the upper back and is quite common in today's world due to looking down at the cell phone. Lordosis is sometimes also called swayback. This happens to many mothers after the birth of the child. This is basically the inner rounding of the lower back. This makes your buttocks and stomach look as if they are protruding. Three-point spinal alignment technique. That allows you to gently yet effectively correct your exaggerated S-curve and start bringing your spine back to its natural, proper alignment for optimal spinal health. It is very important to work through all the movements in the Unlock Your Spine program in their exact order to allow for the proper and gentle realignment of your spine. All the sitting and slash or standing that a person does in one day puts massive amounts of force and pressure on the spine in its entirety, but particularly on the lower portion of the spine. It is most often the case that people go straight to exercises and stretches that address the lower spine. The upper portion of the spine can be neglected. Over time, the impact this has on your spine's natural S-curve is pretty extreme. It is very important that we start at the top and work our way down the spine to be as gentle, yet have the greatest amount of impact on realigning the vertebrae in the spine to its correct S-curve and in the correct order. Working in this order, you will be able to coax your vertebrae into their correct position with very little risk of injury, without pain, and ultimately giving you greater mobility and freedom of pain-free movement. Here is precisely how the three-point spinal alignment techniques works to restore your spine back to its natural S-curve. Point 1. Cervical curve correction. The first part of the three-point spinal alignment technique focuses on gently bringing your 7 cervical vertebrae back into their natural alignment. Working through the first 4 movements of this program in the exact order will allow your cervical spine to correct and realign back to its proper curvature as part of your full spinal S-curve. The realignment of your cervical spine will help to alleviate unnecessary pressure on your atlas that can cause nerve impingement, pain, headaches, and muscular tension in the neck, shoulders, and upper back. Point 2. Thoracic curve correction. The second part of the three-point spinal alignment technique focuses on gently bringing your 12 thoracic vertebrae back into their natural alignment. Movements 4 to 7 of the program, done in their specific order, continue to bring your spine back to its correct S-curve by realigning your thoracic vertebrae. The continuation of realigning these spinal vertebrae will help to alleviate pressure on your intervertebral discs, creating the natural space your thoracic vertebrae need to allow you to live pain-free and with greater mobility and freedom. The realignment of the thoracic vertebrae will help support optimal flexion, extension, and rotation, allowing for greater functional movement throughout your day. Point 3. Lumbar spinal curve correction. The final part of 3-point spinal alignment technique focuses on aligning your lumbar vertebrae to continue correcting your spine's natural S-curve. Now that we have worked through the first 2 sections of the spine to correct the alignment of the first 19 vertebrae, we need to continue with the next movements that focus on the lumbar vertebrae. This will help to bring the lumbar spine into the correct position, so that your spine is now in its correct S-curve. Movements 7 to 10, done in the order that they are laid out, will help to create the necessary space in your lumbar spine, bringing your whole spine into the proper S-curve alignment. With this correction, you will experience a reduction in lower back pain, reduced sciatic pain, and better mobility in your hips. No more. By Unlock Your Spine. Check out link in the description.